Hello, everyone, and welcome to today's discussion on India's transition to digital healthcare. I'm Kirsten Hamann. I'm a Pegasus professor and associate dean in the College of Sciences at the University of Central Florida, and I serve as the interim director of the India Center at UCF. It is an honor to welcome our speakers, Dr. Sanjay Sood, Dr. Anuradha Pichumani, and Dr. Parul Vadgama for our India Center event today. The India Center at UCF broadens the understanding and awareness of contemporary India. It promotes the study of India in the world today and the relationship between the United States and India through partnerships, scholarship and research, education, and outreach. Today's discussion addresses a topic of utmost significance in expanding access to healthcare in the world's largest democracy, and the lessons learned will be of global relevance. I would like to gratefully acknowledge the South Asia Institute at the University of Texas, Austin as the co-sponsor for today's event. Welcome again. Thank you for joining us today. And it is now my pleasure to welcome Laila Chakko, the Director of Public Affairs of the India Center, who will introduce our panelists, as well as Dr. Reid, who will moderate the event. I hope you will enjoy the discussion.
Thank you, Kirsten. Hello, everyone. It's a pleasure for me to introduce our esteemed speakers today. Dr. Reid is going to be moderating today's discussion. Dr. Oetjen is an associate professor and the MHA program coordinator in UCF's School of Global Health Management and Informatics. He is co-editor of the textbook Dimensions of Long-Term Care and the co-author of Medical Practice Management Body of Knowledge Review Series, Planning and Marketing. Dr. Sanjay Sood is an internationally acclaimed digital health innovator. He has his PhD in information technology. Dr. Sood has spearheaded design and implementation of 3 population-scale cloud-based telemedicine solutions. He has been associated with the domain of telemedicine for over 2 decades. And he has also been a telemedicine consultant with the World Health Organization. Currently, he is Associate Director at the Center for Development of Advanced Computing, Mohali. He is the Associate Director and Project Director of eSanjeevani, India's national telemedicine service. Dr. Parul Vadgama completed her medical degree from the BJ Medical College. She is professor and head of tuberculosis and chest department at the Government Medical College, Surat, Gujarat. Dr. Vadgama is a past president of the Indian Medical Association, Surat, and she is the government-nominated syndicate member of Veer Namad South Gujarat University and secretary of the Government Teachers Association, Surat. Dr. Anuradha Pichumani completed her medical degree from the Thanjavur Medical College in Tamil Nadu. She has an MBA in hospital management. She is a gynecologist and fertility specialist. She works as the executive director of Sree Renga Hospital in Tamil Nadu. Dr. Pichumani is a board member of the Asian Society of Quality in Healthcare and chair of its education committee. The COVID-19 pandemic accelerated the adoption of digital technologies across industries in India, including healthcare, which has resulted in new innovations and an increase in telemedicine. Today, the panelists will share their professional experiences of working in the healthcare industry as India transitions to digital healthcare. We will discuss how this experience may change future healthcare delivery, personal practices, and also information technology. There will be an opportunity for audience questions following the initial discussion, so you can use the Q&A function at the bottom of the screen. And now I will hand it over to Dr. Oetjen to start the conversation.
Yes, from India this evening. And so I'm just going to go ahead with Dr. Sood. In your role as Associate Director and Project Manager, I wanted to kind of get your opinion regarding the National Telemedicine Service. How has India been able to implement a free telemedicine service? Most other countries, it's not a free system.
Thank you, Professor Oetjen. India is hosting the world's largest health insurance scheme called Ayushman Bharat scheme. And the majority of the beneficiaries of the scheme reside in the rural areas. And the rural areas, very much like other countries in India as well, doesn't have excellent healthcare services or healthcare infrastructure, specifically at the secondary level and at the tertiary level in the healthcare delivery system. So to ensure that the benefits of this world's largest health insurance scheme reaches the beneficiaries, the government of India planned to implement telemedicine at all the 155,000 health and wellness centers across the country, so that the patients in the rural areas, in other words, the beneficiaries of Ayushman Bharat scheme, they could speak or consult with a doctor without having to travel to the cities or towns to see a specialist, which otherwise would have been an out-of-pocket expense for all these patients. So the whole scheme had been envisaged way back in 2017. We worked on customizing the e-Sanjeevani that we had as per the requirements of the government. And as we were working towards the implementation, we started off from one of the southern states called Andhra Pradesh. It is that the COVID struck Indian shores, and the whole scheme, the OPDs across the country were closed because of the national lockdown. And then the government directed us to put in place a telemedicine platform which could enable the citizens in the confines of their homes to seek non-COVID related expertise or services, health services from the doctors. So I think it was primarily the COVID which paved way for this kind of a large population scale telemedicine platform for the first time in the country. And as the Ayushman Bharat scheme was all about providing benefits to the beneficiaries of the scheme, the telemedicine component was free of cost in that scheme, and accordingly, even during COVID, the patient to doctor consultations through the platform were also planned as free service. And till date, it is continuing as a free service. We've served over 108 million patients using e-Sanjeevani, and each of those consultations have been absolutely free of cost. In other words, healthcare is a state subject in our country, and all the public hospitals provide almost free of cost OPD services. So in the same manner, the same services have been extended to telemedicine as well, free of cost.
That's excellent. So now I'm going to go to our two physicians on the panel, and I'll start with Dr. Vadgama. I'm going to ask, how have you implemented digital healthcare options within your practice?
See, digital, as sir told, the digital healthcare practices, actually we were knowing since so many years, but the actual and real implementation of it started from, to be very frank, from COVID. When we realized that now we have the lockdown is there, we don't have the physical touch of the patients. That time we realized that we need to have this digital platform, not only for treating and diagnosing the patient, but a very important time was to counsel the patient and to give a mental support to the patient. So first time in Surat, it's on the day 2 and day 3, we launched the app for connecting to people who were scared of COVID. So it is in Surat and Gujarat, we started not only just for diagnosis and treatment, but we also started it for counseling the patients. They had a lot of fear, many had depression, to support the patient. So it started as a supportive system in Surat, and then we utilized so many digital platforms for training, because I am also in government, and also at that time I was IMA Surat President, Indian Medical Association Surat President, which is a association of private doctors. So that time I was heading both the things. So that time we had digitalization usage of so many, for so many academic events, trainings, activities, how ventilator trainings, how to operate the ventilators, because I'm a chest physician, so my department prepared so many videos, and that is how it started. And now it is continuing, as Sanjay sir has rightly told, that in Gujarat state and in most of the states, the health is a state subject, and in public facilities, everything is free. Like in our OPD setup, we see 4,000 patients free of cost. Indoor treatment is also free. So telemedicine also we have, very nicely implemented in Gujarat since 2.5 years, especially after COVID. And every week we have the telemedicine duty also. We connect to the rural PHCs every day with the subject experts of all the 23 departments of our colleges, and they support the diagnosis and treatment, especially of the PHC doctors who don't know, may not be confident in that particular diagnosis or subject or that particular patient. So that way we have the eco platform also in tuberculosis, because I'm handling TB and chest department. So in tuberculosis diagnosis and treatment, to teach the rural areas doctors and to solve their queries, especially in difficult to treat TB patients, we have the eco platform which is provided by the government of India and CTD, and through that we take the training sessions, through that we discuss the difficult patients and empower the rural PHC doctors to treat. So it is not only for diagnosis and treatment, but also for training and academics and strengthening the rural health of India.
Thank you so much, Dr. Vadgama. I'll ask the same question of you, Dr. Anu, and I'll repeat that just so everyone can hear it again. How have you implemented digital healthcare options within your practice of healthcare?
Yeah, so good morning and good evening to all of you across various countries who have joined here. And at the outset, I would like to thank the UCF India Center and the South Asia Institute at University of Texas at Austin, especially Ms. Leela Chacko, for having invited me here for this webinar. And to answer your question, Professor Reid Oetjen, this COVID-19 pandemic has impacted every one of us to move on to adopting digital technology. So before COVID-19 pandemic, I think there were many barriers in acceptance of telemedicine in India. And whereas as the pandemic started spreading, it became clear that we need these digital health technology to manage the crisis. So as Dr. Parul and Dr. Sanjay were discussing, so India opened up with the telemedicine guidelines, which came out in March 2020. And in the midst of all lockdowns and restrictions, all of us were into digital technology now, with mobile health apps, contact tracing, and everything started happening. So in our small hospital, I practice in a rural area, semi-rural area. It's called Chengalpattu district, 60 kilometers away from the city. And it's in the southernmost part of India. So we also started our transition into digital health to deliver quality care by adopting various telemedicine consultations, because we take care of various chronic patients, specifically diabetes and hypertension, because the NCD load is very high here. The non-communicable disease in India is very high. So we had to move on with this telemedicine consultation so that we were able to take care of our patients in a better way. But there were various other ways where we were already into telemedicine. So maybe I'll share some of the success stories later as we move on. Yeah, thank you.
Sure. Going back to you, Dr. Sood, from your perspective and your role, what are some of the key success stories you've seen or cases of digital health implementation? And more importantly, what lessons can we learn here in the US? And to give you a little context, similar to India before the pandemic, we did not do telemedicine with our physicians, mostly because there was no reimbursement for that service. And so once that was opened up where physicians could be paid, our physicians jumped right on it as well. And so Dr. Sood, in your opinion, tell us some of those success stories and lessons learned.
Thank you, Professor Oetjen. It is a universally known fact that whenever crisis comes up, the shakeup happens, and then shakeup opens out the opportunities for leaders to show up. And I think till COVID, there were not many digital health interventions at national scale in the country. But as other panelists have also highlighted, it was COVID that gave the opportunity to, I would say, the country to project itself as one of the leaders in implementing digital health interventions at the population scale or at the national scale. Accordingly, the government of India quickly came up with one of the interventions called Arogya Setu, which was an application, a mobile application or a system which was supposed to aid the health authorities in contact identification. Such was the scale of this application that there were more than 100 million installs within 40 days, a kind of a world record in itself. And then this particular application was so useful that it went on to identify over 26,000 contacts, COVID contacts every day. And it in all went on to identify over 8 million contacts all through the COVID. And then the second, I would say, digital health intervention in the country, or the success story, as I would say, could be CoWIN, the platform which enabled the management of the entire vaccination drive, mammoth vaccination drive in the country, 1.4 billion populace, and it managed over 2.2 crores, or rather, I would say over 200 million doses of vaccinations in the country. And then, of course, eSanjeevani, which was put in place with the help of Ministry of Health and Family Welfare, and it showed up as the National Telemedicine Service. It assumed its role as a parallel stream of healthcare delivery system across the country, and very quickly was adopted by all the stakeholders, including doctors, health workers, the patients as well. And now it has shaped into the world's largest telemedicine implementation in the primary sector, wherein we have over 150 specialties, not only the English system of medicine, but also the traditional system of Indian system of medicine as well is hosting eSanjeevani online OPDs. And on daily basis, eSanjeevani has served over 500,000 patients on a specific day in December, and on an average, it is serving over 300,000 patients daily. So these are the leading three success stories in the domain of digital health in the country. And besides that, the government of India is also putting in place, or rather implementing, Ayushman Bharat Digital Mission, which is also called ABDM, which is shaping the country's digital health ecosystems backbone, which will not only ensure interoperability amongst the practitioners, the health facilities, and the patients, but will also lead to a lot of other benefits in times to come. So that is it. Thank you, Professor.
Okay, thank you. Maybe for our American audience, you talked about two different systems of healthcare. Maybe you could just very briefly, whoever would like to volunteer, Dr. Sood, any of our practicing physicians, to kind of briefly describe that for the American audience, that would be wonderful.
Any specific aspect you would want me to highlight, Professor?
Just a very broad definition, so there's a better understanding of your health system. You talked about two different traditional medicine versus.
I would suggest, in case one of the medical practitioners could highlight that, because they are into the delivery system. I'm sure they'll be much more clear about in their responses about the healthcare delivery system. So may I request Dr. Anuradha to maybe chip in?
Yeah, I will do so. Yes, Professor Reid, in India, we have the public healthcare system and the private healthcare systems here. So, and then we have various traditional healthcare along with the allopathy health systems, what we all practice. So I think Dr. Parul represents the public healthcare system, and I represent a private healthcare practitioner. So we have nearly the whole of India. It's a vibrant country with more than 1.4 billion population. So we need to cater to all this, the whole population. And so we have multiple private hospitals also across the countries. And again, the government of India has pitched in with small public health centers, the district hospitals, the government medical colleges. So all of us are trying to meet out to the demand and the supply. So this supply and demand has to be done in a better way. And that's where this digital technology comes in, so that all of us meet it out in a better way. Because I feel the two most critical things for any efficient healthcare system is accessibility and affordability. So to access a patient and to make it more affordable, we need to work on these digital health technologies so that we take it to the nook and corner of India. So this is a short brief of the way the whole healthcare system is there. But healthcare is again a state subject. And we have various traditional medical practitioners along with the allopathy practitioners who are practicing. And in India, we recognize all these medicines separately. Thank you.
Thank you. Thank you so much. That helps us understand your system a little bit better. So thank you for that explanation, Dr. Anu. And I will switch over to Dr. Vadgama for this question. So with the new digital health technologies that were implemented during COVID-19, what benefits have you seen for your for your patients? And Dr. Anu, I will ask you this question in a moment as well. So kind of the benefits that you didn't have prior to this telemedicine being implemented.
Yeah, sir, if I see, basically, as I told that COVID has, brought a revolution in the digital technology and digital implementation also. First point which I want to highlight is our drastic improvement in our record system. The electronic medical records which we were, making and registering previously, and now we are registering with the help of the HMIS system in our medical and most of the colleges of Gujarat. It is a big difference. So the record system, the electronic record system has a big change at a grassroots level. And now we are going towards the appointment based, record based, electronic based, online, appointment based booking also in the public care system, which is very difficult to give the appointment to 4,000 people in a one single day. But we are going to do that. So we means all the colleges and public health system of Gujarat. So we are in a way towards the online appointment based, online booking of the appointments, OPD based appointments. So that is a big change which I have seen in last 3 years. Second thing which I could see in the COVID is that because the patient relatives were not allowed inside, nobody was allowed inside. So we developed almost all the public health system developed a monitoring system. We called it as a control station and a help desk. So that was again a new thing which apart from the COVID and the Arogya Setu app, this sort of control station and monitoring system which was developed for all the wards of the COVID patients across the hospitals was very new thing, and it helped the patient relative also. And through that online we could connect specifically to that ward also, and it was monitored not only at local level but also at the ministry level of Gujarat, of course at the national level. So this online monitoring system and connecting system with the patients and connecting through the video calls and other apps was very much a new experience, and which we think it should be continued for all the disease and all the situations, because monitoring always adds to the quality of the work. And one third most important thing which I could see was that now many rural centers are now converted to wellness centers. So there also they are getting patients are getting connected digitally, and we as a tertiary care hospitals are also connecting digitally. So these things have developed in last I would say 3 to 4 years, and especially my private doctor friends, now many of them, I would say 30 to 40% in Surat city now they have shifted to the electronic record system. They are registering their patients online, they are registering they are writing the prescription online, and then they are giving the print to the patient. And especially when the COVID time was there, they were not even getting the print, doing the print to avoid the fomite and paper, touching of paper. They were just doing it on digital and sending it on WhatsApp or sending on mail. Even lab reports now, most of the people are sending on mail. There is less usage of the paper and printed material after COVID. And these are some of the changes and evolutions which I see in the government as well as private sector.
Okay, thank you, Dr. Anu. Your
Yeah,
thoughts
thank you
on how it's really changed the way and impacted the way you've practiced medicine, and really what benefits have you seen for your patients?
Yeah, thank you for that. So digital health technologies have always transformed healthcare. And so it always also improves the patient outcomes very significantly. The way we have done it all these years. So I was telling you, it's our hospital is now 3 decades old. And with the help of digital technology, we were able to convert a traditional hospital into a smart hospital. So this smart hospital, to convert it into a smart hospital, we needed to work on various ways. Even before pandemic, our small hospital had to go on with various innovation techniques to deliver the healthcare what we required, and also to improve on the quality and safety of the patient. So technology was a proven game changer in that. So I will share with you the 3 things what we did in our hospital even before the pandemic. The first was starting a tele-ICU unit in our hospital. So though we feel running a tele-ICU is difficult, but we are out of resources. We don't have that type of resources in every part of the country. So to get an intensivist all around to give a 24 hours care is a difficult thing in rural areas. So tele-ICU has been a game changer in managing critical patients in our place. And so our hospital is Sree Hospital in Chengalpet district. So what we did was we collaborated with a tele-ICU partner, tele-ICU provider, and these intensivists were located remotely, and they were able to guide us in taking care of our patients through video conferencing, along with our own doctors inside the hospital. So our anesthetists were reviewing the patient records, and we were able to run the ICU. And now we have the last 6 years, we have been doing it on our own because the confidence level of the staff has picked up and the team has picked up. And now we are in the process of expanding our ICU into a 10-bedded ICU now. The second place we were able to use digital technology was in teleradiology reporting. So we took the help of teleradiology because it's a very cost-effective model for hospitals, again, with resource-challenged areas. So we interface the hospital's diagnostic equipment with the vendor's application on the computer. So when we were able to interface it, expert radiologists sitting remotely, they were able to view the images from here, and we were able to ensure that data safety, the security of the whole transmission, and then they were able to give us a report on time. So the turnaround time was better with a better patient outcome, and also we were able to improve the patient satisfaction. That was the second area. And the third area was we took the help of telemedicine again and teleophthalmology. Ours is a hospital with a huge number of diabetic patients. In South India, it's really high. So, and since my husband is a diabetologist, so we wanted a retinopathy screening to be done for all our diabetic patients. And again, getting a retinopathy specialist is very difficult in remote areas. So we took the help of our teleophthalmology unit. And this enabled our diabetic patients to access critical eye care services. So we were able to capture the fundus image of these patients with our trained technologists. And these images were sent to the ophthalmologists, and they were able to give us a screening related to diabetic retinopathy. So these were 3 areas which our hospital was already working on. And when the COVID pandemic struck, so we were moved on to further digital innovation, and that was with the teleconsultation, as both the other doctors have told us. So we moved on with the change in the data transmission. We improved on our connectivity, and now we use this digital health technology for data collection, storage, transmission, and again, we are using it on HMS, the hospital management software. So we are now moving on to e-prescriptions now. So all our nurses have been trained to do e-prescriptions, and it's become more paperless now. And all these nurses are from rural areas. So training these people, taking on with digital technology has been a real game changer. And when you do this e-prescription, the errors have come down because there is no prescription error. And so we were able to improve on the quality and safety. Again, to use certain medical devices, we have been using digital technology, like we use continuous glucose monitoring devices, the CGMs, what we call here as. So these continuous glucose monitoring device is fitted onto the patient, and it gives us real-time data of what is the glucose levels for the patients, and it helps the doctor to adjust the insulin levels. And again, we have the help of continuous ambulatory blood pressure monitoring devices. So these are some ways where we have started using interactive devices. And again, as Dr. Parul was telling us, we have been using these digital technology for training our staff, again in data collection, data validation, and we have been running various quality initiatives with the help of digital tools now. So I think overall the digital technologies have a potential to improve the healthcare delivery, the way we do it. And also it has increased the access to healthcare services for our community. And also it has improved the overall patient outcomes and satisfaction. Thank you.
Thank you. No, it sounds like your this digital initiative has really improved outcomes for your patients. You talked about having some of these smart devices that will give you the physician's real-time data. From a patient perspective, have you seen any changes in how maybe patients are empowered to take care of themselves and be more active in these roles, given the fact that they may have a glucose monitor, heart rate monitor to help them with the care? And do they feel more empowered? And what do you think your clients think of digital health in general? So I'll start with Dr. Nadu. You had mentioned these devices that some of your patients are using. How have you seen their role in their own healthcare change?
Yeah, thank you, Professor Reid, for that. So India is now rapidly changing into digital technology, as we have been discussing. But providing a personalized and proactive care is very important, because all of us are moving into the person-centered care. And I am working across various groups on giving person-centered care, like person and family advisory councils have started coming up. In India, it's all new. But with the help of digital technology, now patients' expectations are also improving. And so we need to meet the patient's expectation. And so it has to become more personalized, and it has to be at the convenience of the patients. So one way is we can improve the usage of the wearable devices, like the smart fitness trackers, the smart watches. And again, I was talking about the continuous glucose monitors, the ambulatory blood pressure monitors. So these are devices which help us to track the health of these patients and give us real-time data. So this real-time data will help us to make informed decision making. And again, when we use these devices, when the patients use these devices, they are into the decision making. So the patients are more empowered into the decision making. We involve them in the decision making. And so it improves the patient satisfaction. They understand it better, and they also continue the treatment also in a better way. Again, telemedicine, as we have discussed, it has improved the whole access now. It has opened up platforms where patients are able to talk to doctors sitting at their home, and it's become more personalized now. And again, we were talking about the electronic health records. This digitalization, and India is moving fast ahead with the ABDM. So the Ayushman Bharat digital mission, where we are going to see the access to medical records across India now. So we are just waiting for the scalability and what is going to happen, because it's a huge country. And when a patient moves from one state to the other, he needs to access his medical records. And every healthcare provider has to access the medical records. So this will be a real game changer when we start accessing health records. But we need to think about the safety and security of the data. And again, we were talking about these diagnostic tools. This is again one of the personalized tools where we take the help of artificial intelligence. We now have artificial intelligence for various images now. Like I was talking about the diabetic retinopathy screening. So these images help us to diagnose it in a better way. And it gives us a faster reporting facility also. And again, we were talking about the monitoring, patient monitoring across in virtual arena. So that has helped us to improve the monitoring of patients in COVID ward areas. So these are some of the ways where we can give them personalized attention to patients, and it helps us to talk to the patients in a better way. And we are revolutionizing the whole healthcare facility, which we can provide in India. Thank you.
Thank you so much. I'm going to go switch back to Dr. Sood. I want to ask you some of the privacy and data security concerns that have been mentioned. What challenges, what have you seen, what needs to be improved in terms of data security and patient privacy?
As far as data privacy and the security is concerned, most of them are addressed in the telemedicine service, because the National Telemedicine Service conforms to or complies with the EHR guidelines of the Ministry of Health and Family Welfare, and then it also complies with the which in turn complies with the IT law in the country, wherein the data at rest as well as data in motion is to be secured. And we've taken all the measures to ensure that the data is safe and is secured. Hence, we are complying with all the norms in the country pertaining to the personal information and health data.
Yeah, in the United States, we've had some data breaches with the different and disparate systems that our practitioners use. And so I was just wondering if there were any issues like that in terms of, as well as in terms from a provider standpoint, even perspective of the patient, do they feel comfortable with the data security and privacy that the current system uses?
As far as eSanjeevani is concerned, majority of the beneficiaries are from the rural areas, the rural populace. They're not much fussy about the data yet. However, there has been no such breaches in the patient data as far as eSanjeevani is concerned. So we are fortunate that we have put in place all the measures which ensure that the data is secured and safe on the platform in the databases.
Thank you. I'm going to switch back to Dr. Vadgama. As a practitioner, have there been any challenges you've seen in your hospital from either your own perspective or other colleagues with the using EHR, using the telemedicine? In the US, for instance, a lot of our physicians don't want to use the electronic health record because it's not very easy. I've seen other adoptions, like for instance, in Russia, the voice to text isn't great. So they required all their physicians in the city of Moscow, the state of Moscow, to learn how to type. That doesn't necessarily work in our country, in the United States. But from a physician perspective, is this getting in the way of delivering medicine? And what kind of improvements would you recommend, if any?
Yeah, so I would say that telemedicine definitely it is on a right path, and it is growing. It is definitely going in right direction. But still, I think we need to train our, as ma'am told, we need to train our staff, healthcare staff, because many of them are not trained, especially in rural areas. Even in city areas, urban areas, we need to train them properly. Second thing, we need to teach them the security and privacy, how to maintain the privacy, because see, as per the regulations, definitely we are following, but every staff has to be sensitized about the utilization of telemedicine. And as a doctor also, we should know, and we should be, as a clinician, we should be able to analyze which patient I can take on telemedicine and which I should require in order to come for the physical examination. Because there is always, for example, cough. So cough has so many reasons, and if on digital medicine or telemedicine that patient has cough because of some cardiac failure, so that is again going to be havoc. So as a consultant also, we need to be very proactive and very much detailed questioning about the patient. And of course, the person who is sitting at the second side should also have a good knowledge. So it is, I don't say that it is not useful, it is definitely useful, but at the same time, we have to be more careful. When the patient is near to us, we are more comfortable and we have more confidence, but when the patient is at distant level, we have to be more careful that we don't miss any diagnosis. And especially the investigations, if they're not available, we should do. So telemedicine is a good, definitely it's settled good, but it needs lot of care, lot of training, and lot of alertness. And of course, there are some regulations and rules should be more clear, that if we examine the patient and if a patient dies, then who will be responsible. So sort of guidelines should be there for every situation, that that if that is more clear or more elaborated, that will be better. And one more thing, which the younger generation, I think the telemedicine, for because I'm a medical teacher also, so I think it should be, computer should be taught in the first year of MBBS. Many students I have seen that they know it very well, but there are so many students who don't know. So I think telemedicine should be taught in the first year UG curriculum, or they can be, there can be added classes for that, but it is very important part of the practices. Even nurses should be taught, paramedical and servants, all should be taught. Especially, I have seen that when there was a COVID, Surat Municipal Corporation had a control room, and where all type of people were working. So at that time, we realized that the digital literacy is very important in all the employees of the government or corporation, or even in private practice. And if it is there, we could, Surat Municipal Corporation achieved the award for running one of the best control room in SMC. So that was only because of the digital literacy. So again, I stress upon, acceptance is now there, acceptance is increasing also, but at the same time, proper training of all segments of the health sector, and of course the legal training of the doctors is also very important as far as the proper implementation of the practice of telemedicine is there.
Thank you, Dr. Vadgama. Before I go to Dr. Anu for the her response to that question, I'll just let the audience know that in several minutes we will go to you for questions, and please feel free to use the chat to post them, and I will be happy to read those to the panelists. So Dr. Anu, what resistance to change have you seen from your physician colleagues or even yourself?
Yes, it's always a challenge when we want to have any change. So overcoming the challenges are the way we have to do it. We need to innovate things, and again explain to people that this changes for the better. So again, when we think about digital health technology, as you have discussed, there are certain challenges in private sector where we have to think about the adequate infrastructure, because the internet connectivity in some of the places is still not good, and we need to have access to the digital devices. Again, cost of digital technology can be a barrier to some of the doctors practicing in rural areas. And the other factor will be the data privacy and security, as has been discussed. And again, many of the physicians are resistant to change, to any new technology, because they are very comfortable with whatever they were practicing. So there are several strategies to be done to improve on these challenges. So the first thing will be, we need some government support because it plays a crucial role, where if there are more financial incentives and regulatory guidance, then more number of people will start adopting these digital technology, because we need more of regulatory guidance now before we get into issues of data breaches or whatever is the issue. So, and again, we need more of financial incentives so that people do start innovating, and we encourage the startups so that more number of startups can come up in India. Again, we need to work on the public-private partnerships so that with these resources, we can address the cost barrier. And training, the digital literacy has to be taken care of. The literacy has to be both for the stakeholders, for the doctors, paramedical people, nurses working inside healthcare organization, And also the literacy has to be done to the patients also, because they also need to understand what are the benefits of using this digital technology and what are the risks involved in using this digital technology. So we need to improve on our data privacy and security. And cultural change is always an important thing when you are going to adopt any new technology. And physicians need to be very open. And we have discussed these things with our own staff. And our hospital being a very small hospital, it's just a 50-bedded hospital in India. So this adopting new technology is up to the mindset, the implementation from the top leadership, and the top leadership willing to adopt new technology and in anyway encouraging all the staff. So these are things where we will be able to implement it. But to anyway implement these policies, these regulations, everything has to be with the engagement of the stakeholders. Whenever any policy or regulation is going to be given, if you are able to engage the stakeholders, it will be more effective and it will be widely adopted. So, and again, it has to be reviewed. All these policies have to be reviewed and updated as the country evolves around the digital health, because this is a rapidly evolving digital health landscape, what we see in India now. So this has to be updated on a frequent basis. Thank you.
Thank you, Dr. Anu. Dr. Sood, going back to you, I'm not seeing any audience questions yet, so please feel free to post. In terms of helping grow telemedicine and the digital transition to health in India, what are the key priorities for policymakers in the Indian government to help support this and promote the continued adoption of these technologies?
That's really a good question, because despite rolling out a national telemedicine service, we have observed that there are certain challenges which are yet to be addressed, and these can only be addressed by the interventions at the policy-making level. The biggest of them is about ensuring internet connectivity or the internet services in the rural areas or remote places. We have seen in certain places the quality of service of internet, or rather internet services quality, is not so good. So at least for these kind of services, health services or telemedicine services, there needs to be some sort of a policy in place which ensures optimum bandwidth for health facilities or to these specific services in the country. So I think that is the first, challenge or the first priority, rather, for the policymakers to ensure that these services are seamlessly available in the best, at the best quality levels. And then followed by this, I think our panelists have already highlighted the need for data security and data privacy. There needs to be certain provisions in the policies which also should address the confidentiality part of the patient's privacy. While operationalizing telemedicine platform, we've come across certain cases, although very, very few of them, but still there have been certain cases where the doctors have been harassed. The women doctors have been harassed a few times, especially at the late night telemedicine service. And just because the legal system is such that it looks for all those evidences when this kind of instances come up. So there might be a requirement of putting in place a policy where the culprits or people who are exploiting this platform or this service do not go scot-free, and they are taken to the task at the quickest or the quickest time or speed. And this certainly is very much telemedicine oriented policy intervention that needs to be put in place. And then besides this, very much like in the traditional healthcare practice or medical practice, there needs to be certain policies around the quality of the service that is provided by the practitioner to the patients through telemedicine, like quality audit of e-prescriptions, there has to be a norm or standard operating procedures which ensure that the quality is maintained at the same level where we have the quality being maintained at in-person consultations. And then besides this, I think the other very important aspect which needs to be addressed by the policymakers is about delivery of medicines. We are providing free of cost service to the populace through eSanjeevani, but in hospitals, there are provisions wherein the medicines are also provided free of cost. So yet, there have been a couple of trials in a few states where after running a telemedicine consultation on eSanjeevani, the state health administrators have put in place mechanism which enable the local pharmacy warehouses, the public owned pharmacy warehouses, they made attempts to deliver medicines as well, because a copy of the e-prescription, when it goes to the patient, it also gets delivered to the nearest drug warehouse, and then they have made attempts to deliver the medicines as well. So there are additional costs for delivering the medicines. However, these are surmountable, and I'm sure very soon there will be policies which enable these facilities as well, and will make telemedicine even more favorable and popular amongst patients. Thank you.
Thank you. We do have a question in the chat. It talks about how the United States, we struggle on implementation, and physicians and patients, everyone embracing these new technologies, and wondering some of the strategies that you use, but also, was it easier in the public sector or in the private sector for these technologies to be adopted? And
I think telemedicine was equally adopted in the private as well as public sector in the country. And to the best of my understanding, the Indian government was smart enough to latch on or to exploit the little opportunity window that we had during COVID. And it was something like right timing for rolling out digital health intervention, which really was, was a runaway success on both the ends as far as adoption is concerned. The patients were not wanting to go to the OPDs or to the health facilities because of the fear of contracting infection. The doctors too were to some extent scared of seeing patients who were unwell, just to not contract infections again. So those feelings, or rather that era, the pandemic era, gave the biggest boost to such, inhibitions which were there earlier before the COVID, showed up. That the practitioners as well as the patients were not adopting these technologies. So I think it was that little window of COVID or pandemic that helped us to implement this kind of mammoth telemedicine platform. And then once they got used to the potential of telemedicine or benefits of telemedicine, there was no looking back by neither the health administrators nor the practitioners, and even the beneficiaries or the patients. So I think that was the biggest advantage for us to ensure that implementation happens rapidly. And I think the success stories that India has learned or India has produced, there has been an interesting impact assessment done by an independent NGO here in the country on eSanjeevani in one of the provinces called Jharkhand. And they've produced interesting findings out of that study. The findings state that every teleconsultation on eSanjeevani platform in the rural areas leads to a saving of a journey or an avoidance of a journey of up to 21.5 kilometers, which is close to around 12 miles. And it also leads to a saving of out-of-pocket expense to the tune of 941 rupees, which is around $11.5 US. And these are direct and indirect costs. So these kind of lessons or the outcomes of telemedicine at such a huge level in a country like India can really or will really influence similar countries, and even the countries who are way ahead in IT adoption in the other domains. So we are hopeful that the Indian experiences and Indian lessons will help propagation of IT in the healthcare domain or digital health world over.
Thank you. We are quickly running out of time. And so the last question I just want to get whichever practitioner would like to address it would be, what do you see the future of digital health in India, particularly as it relates to patient-centered care and quality improvements? And I think we may only have time for one panelist to answer that. So either Dr. Anu or Vadgama.
Yeah. Sir, I see the future is very bright, very promising, and there is high level of acceptance in the young generation, definitely, but in the middle and old generation also, they are now used to all these technologies. In fact, now, you know, our interviews, our meetings, our private meetings, doctors meetings, everything is going online. We save a lot of time, lot of money. As sir told, patients saves a lot of money. They don't have to travel. Even the doctor, radiology, they are running so many centers, radiology centers in the periphery simultaneously. So that is decreasing the cost of investment of a radiology center, and of course the facilities are extended to so many centers at the same time. So I see it as a win-win situation for the patient as well as doctors. And of course, there is a lot of acceptance. I would say around 60 to 70% of the health workers are now, you know, they are ready to accept it. They are in phase of learning, and many have learned also. And of course, not only the patient and doctor treatment relationships, but also the hospital administration is improving with that. Hospital interview system, the hospital appointment system, all these are changing. And dissemination of the strategies of the hospital, dissemination of the policies of the hospital. In fact, taking the exams, taking the feedbacks, everything is going online. I am also an NABH assessor. I see that most of the hospitals are now going towards entry level NABH, because it is also one of the mandatory thing in the Mediclaim. So NABH entry level, there most of the hospitals are going electronic, with electronic registrations and electronic feedback mechanism, electronic maintenance of the data of the staff, salary entries. All these things are changing very fast. And I see a time when in maybe next 1 or 2 years, majority of the hospitals and health services and health providers will be digitally active, and they will be happy to use it. So they will accept in maybe in next 1 or 2 years, not very far.
Thank you. I think we continue this conversation for several hours. And so I do want to thank each of the panelists for your time. And I'm going to turn it over to Layla to wrap us up. Thank you.
Thank you so much, Dr. Oetjen, for leading this really educational discussion with today's expert panel. And thank you so much, Dr. Sood, Dr. Vadgama, and Dr. Anu. I really appreciate you taking the time to speak with us about your experiences with India's transition to digital healthcare. And thank you so much to our audience for tuning in today and participating. Next week, the India Center has an in-person event on the UCF main campus talking about India's partition. And we do hope to see you again in person or virtually. So thank you so much for joining us.